Take 12.
Hello, this is James Wright again, giving another speech for my public speaking class. Our audience today is going to be Chris, Matthew, and Kim. If y'all wouldn't mind having a seat around the camera. The speech today is going to be a demonstrative speech on chest compressions, a block of CPR. Let me begin by asking this. If your best friend went into cardiac arrest in front of you, would you know what to do? It'd be a scary thing to witness, but by having some kind of knowledge base, maybe it would be more apt to helping them. See, as a paramedic with close to 10 years of experience, I know that advanced CPR takes roughly about 5 people performing 5 different jobs. One of those jobs is chest compressions, and it is one of, if not the most important job. The reason being is because when a person goes into cardiac arrest, studies have shown that there's enough oxygen in the blood to sustain life. What it lacks is the circulation, which is where the chest compressions come in. What you're going to be doing is compressing the heart to get the blood flow to the brain and the vital organs of the body. So before we get started, there's a couple things I want to mention. Firstly, the purpose of this demonstration is so that if a first responder or a certified healthcare person on scene somewhere needs your help, that you can give them a hand doing their duties. By watching this demonstration, this will in no way certify you in CPR. It just makes you knowledgeable enough to help somebody who is certified in performing these duties. If you're the first person on scene and you see somebody going into cardiac arrest, obviously the first thing you want to do is have you or another person call 911 and get the ambulance on its way. There's also some other things to think about, such as safety. Safety is always first. If whatever put that person into cardiac arrest is present, let's say a lightning storm or something like that, you want to either get them out of that environment, or if it's an environment you can't remove them from, don't go in yourself, unless we have 2 people that needs rescuing instead of 1. Another thing to mention is if there's blood all over the person, you want to try to minimize your contact with that blood because you don't know what that person might have, some kind of communicable disease. And lastly, there are some situations when you would not want to perform chest compressions. One of them is obvious death. Let's say, for example, decapitation. Because heaven forbid you see something like that, but if you do, obviously a person is decapitated, doesn't need chest compressions. Another one is if family on scene has a do not resuscitate order. If they're breathing, because a person breathing does not need any chest compressions whatsoever. Or if the certified healthcare people on scene has enough help that they don't need any more hands, you'd just be in the way. So just follow the instructions of the people present. With that in mind, we'll get into the actual performance of it. The first thing you're going to want to do is remove their clothing. Obviously, if it's a female, you want to try to preserve their decency the best you can. Either remove them from the room, move the crowd off somewhere else, ask some police officer to do so, or have a couple people stand with a curtain. But the idea is you want to have hand-to-skin contact. That is going to help out with your actual chest compressions. For the purpose of the demonstration, we're going to say that our victim is an adult male. What you're going to do is locate the nipples and draw in your mind an imaginary line in between those nipples. The palm of your hand is going to go in the middle of that chest, in the middle of that imaginary nipple line, right on top of the breastbone. That's where you're going to be placing your hand. When you're going to place your hands on their chest, some things you want to look for are obstructions. If they have, let's say, a medicine patch or an external monitoring device, if it's out of the way of your hands, just leave it alone, don't mess with it. If, however, it's in the middle of the chest, interfering with where your hands are going to be, you're going to have to remove it. Again, this is a life or death situation, and your hand contact for the chest compression is going to take priority here. When you're pushing inward, you want to go about half the depth of the chest, which is approximately 2 inches deep. In compressing, a proper compression, the best way to do it is going to be to place one hand on top of the other, interlacing your fingers. This is going to give you the fulcrum that you need to get that depth. Also, you want to ideally be looking down on the patient so that you can get a good momentum, keeping your arm and your back straight. All the movement is going to come from the hips. Pushing straight down about 2 inches deep. When you're coming up from that compression, you want to allow the chest to come completely back up. That's called full recoil. If you don't allow the chest to fully recoil, the heart is not refilling with the blood properly to get a good pump going to the rest of the body. You don't have to completely take your hands off the chest, just allow the chest to completely come back up. If the chest is not fully recoiling, you're not doing any good in compressing for the heart. So, all the way down and all the way up, it's one compression. You're going to compress down at a rate of about 100 beats per minute. That's roughly, if you're familiar with the song Staying Alive, the song Staying Alive has a rhythm of about 100 beats per minute. The 100 beats per minute is the rate you're going to be going at. So think about Staying Alive, think about that rhythm. I'm going to demonstrate here about 10 or 20 beats. Notice how by doing so, my arm and my back are staying straight. All the motion is coming from my hips. We're getting full depth and full recoil on the way back up. Speaking from experience, when you go to compress down, there's a chance that you may feel the ribs breaking underneath the skin, and that's normal. Again, this is a life or death situation. Obviously, a not beating heart takes precedence and priority over some broken bones. Lastly, there's a couple other situations that we're going to mention that you need to adapt to in order to be effective at your compressions. Let's say, for example, the surface upon which a person is laying upon when you're going to be doing your compressions. If they're laying on a couch, a bed, a driver's seat, or a cushion of some sort, that when you press down on them, they're actually going to be sinking into that cushion. You're not getting the full depth of your compression. You're going to either have to remove them from the bed and place them on the floor, or place a board behind them, something that you can get a firm surface to get the proper depth that you need for those compressions. We're going to continue with those until the ranking healthcare provider on scene can relieve you of that duty. If you get feeling tired, let them know so they can give you a break or assign somebody else. They may rotate with somebody else so that the quality of these compressions keep up. If your rate, your rhythm, your depth, and your recoil is starting to get sloppy, you're not doing any good for the patient. And get some help. You're not in it alone. Remember that in a cardiac arrest situation, the person is already at their worst case scenario. It can't get any worse for them. So anything you do can only help them out. You just have to have the courage to do it.